Now, this is the next part of this ST elevation MI. Now, we have already seen the ECG changes. Now, it's very easy when we can label a patient that that patient has ST elevation MI. So, to label it as ST elevation MI, the patient must fulfill two out of the three criterias. There are total three criterias, out of which the patient must fulfill two criterias. Then we can simply label that the patient has ST elevation MI. Now, as we are labeling this as a MI, and as we are labeling it as ST elevation MI and not as non-ST elevation MI, ST elevation is must. So, the patient presenting to the casualty to the hospital, whenever we do ECG, the ECG must show ST elevation. This is the absolute criteria if we want to label the patient as ST elevation MI. So this is the first criteria the patient must fulfill. And the other two criteria are either the patient must have some symptoms or the patient must have cardiac biomarkers positive. Now, what are the symptoms? As this patient has come to the hospital, there must be some reason. Otherwise, why would the patient come to the hospital by itself? So there must be some like chest pain or palpitations or weakness or shortness of breath or whatever is the symptom. There must be some symptoms. So the most important symptom which are very highly specific to heart is chest pain or palpitation or angina. Now this chest pain is usually central. It is like compressing type or heaviness type, or the patient may feel like there is a huge stone which is put on their chest. It can be squeezing type of pain, or it can be very hard, huge type of pain that the patient usually show that it is present behind the sternum. This pain, chest pain, may radiate to jaw, may radiate to medial part of right upper extremity or left upper extremity, but it usually never is present below umbilicus. So the patient usually always has some or the other symptom. That is the reason why they come to the hospital. Otherwise, the patient would not come to hospital at all. So chest pain or chest pain equivalent. Equivalent means the patient may not say that he has a chest pain. The patient may simply say that I am feeling very shortness of breath, or I'm feeling very breathless. So this breathlessness or shortness of breath or palpitation or lethargy or weakness, these are all called chest pain only, or we can call it as chest pain equivalent or angina equivalent. So if there is ST elevation and if the patient has symptom, we can simply label that the patient has ST elevation MI. That's all. Uh, if the patient doesn't have these symptom, or this patient may have the symptom, we immediately send the cardiac biomarkers. It is very easy. If we are labeling this patient has heart attack or MI, it means there is acute damage of this left ventricle ongoing, or which is damaged. So as this muscle is damaged, automatically the uh, muscle particle or muscle component are troponin or the creatinine kinase. This is all a part of muscle. So whenever this cardiac muscle or heart muscle is directly damaged, these chemicals are released in the blood. So when there is no heart attack, when the muscle is not damaged, these biomarkers, there is no reason why they should be present into the blood. If these patients don't have sepsis or kidney issues, these markers should not be there at all in the blood. So if these are present in high or threshold level, it definitely tells us that there is significant damage of this muscle, cardiac muscle ongoing. That is the reason why this troponin I, which is a part of cardiac muscle, this troponin T, which is a part of cardiac muscle, and this creatinine kinase, myocardium specific, this is a part of heart itself. That is the reason why these chemicals are increased in the blood to more than the threshold level or normal level. Hence, then we can label that this patient has ST elevation MI. Very commonly, as soon as a patient get heart attack, The ECG may show ST elevation MI, but these chemicals may not be in that much amount to show uh, high levels in the blood. In that scenario, what we do, we simply repeat these blood tests after around 6 to 8 hours of repeating the first sample. So if we send suppose these biomarkers at 2 a.m. in the morning, and if they come negative, then we again send the sample at 8 to 10 a.m. in the morning. That time, mostly if it is MI, these biomarkers definitely come positive. So whenever we want to label a patient that the patient has ST elevation MI, there must be elevation of ST segment. It is an absolute criteria. And this patient may have these symptoms like angina, chest pain, diaphoresis, sweating, lethargy, palpitation, or this patient may show the positive cardiac biomarkers. So out of the three, the patient must have this, and either of this would work, and we can label this patient that this patient has ST elevation MI. What to do? I'll tell that in the next series. Thank you.